1. A new CNA is being trained in trauma care. To ensure adult learning principles are followed, the preceptor should focus on which of the following strategies? A. Providing lengthy lectures with limited interaction. B. Using real case simulations and encouraging problem solving. C. Repeating textbook definitions verbatim. D. Assigning multiple choice worksheets without discussion. 2. During a code trauma, a CNA fails to report a patient's rapid deterioration. What is the most effective method of performance evaluation to prevent recurrence? A. Weekly peer reviews. B. Unstructured observations. C. Structured debrief and competency checklist. D. Random patient interviews. 3. An CNA demonstrates a gap in sterile field setup during trauma prep. Which adult learning principle should guide remediation? A. Directive instruction with no feedback. B. Punitive correction to reinforce memory. C. Hands-on demonstration and immediate return demonstration. D. Passive video observation. 4. When developing trauma orientation for CNAs, which curriculum component ensures alignment with regulatory standards? A. Anecdotal case studies. B. Informal mentor stories. C. State-mandated skills checklist. D. Peer-contributed content. 5. A CNA preceptor needs to improve communication during shift change in the trauma bay. Which method best supports effective handoff? A. Email summary of the shift events. B. Verbal report without documentation. C. Use of a standardized SBR communication tool. D. Whiteboard notes with minimal interaction. 6. An CNA asks, why do we have to learn about spinal precautions? What adult learning strategy addresses this effectively? A. Because it's policy. B. You'll understand later. C. Let's review a case where failure led to paralysis. D. We'll skip that for now. 7. Which of the following best evaluates an CNA's ability to respond to airway compromise? A. Verbal quiz about oxygen tank labels. B. Observation during a real trauma simulation. C. Written essay on airway anatomy. D. Matching terms to emergency protocols. 8. A new CNA struggles with the pace of trauma care. Which mentoring approach is most effective? A. Daily criticism without feedback. B. Gradual exposure with guided coaching. C. Letting them observe without participation. D. Removing them from trauma cases. 9. Which action violates HIPAA regulations during trauma triage? A. Logging out of the EMR when stepping away. B. Discussing patient injuries at the bedside. C. Sharing patient details over the phone with an unauthorized person. D. Transporting a labeled specimen to the lab. 10. An CNA needs feedback on blood spill cleanup. What method supports skill development and regulatory compliance? A. Public correction in the break room. B. Silent observation with no comment. C. Real-time coaching based on hospital policy. D. Peer-led guessing session. 11. Which component should be emphasized in a trauma care curriculum for CNAs? A. billing codes. B. Psychological theory. C. Time-sensitive interventions and prioritization. D. Basic nutrition counseling. 12. In trauma resuscitation, a CNA hesitates during compressions. What is the best preceptor intervention? A. Demonstrate, then observe or return demonstration immediately. B. Lecture them about cardiac output. C. Assign a research article for later. D. Remove them from patient contact. 13. Which mentoring technique best helps CNAs build resilience during trauma exposure? A. Ignoring emotional responses. B. Assigning more shifts to desensitize them. C. Debriefing and emotional support discussions. D. Asking them not to talk about trauma cases. 14. What communication approach is most effective during multi-casualty trauma alerts? A. Side conversations. B. Color-coded wristbands only. C. Clear, direct communication using closed-loop techniques. D. Waiting for all to finish talking. 15. When evaluating a CNA's trauma room readiness, which method ensures objective assessment? A. Personal opinion of the supervisor. B. Competency-based skill checklist. C. Number of shifts completed. D. General workplace reputation. 16. A CNA documents incorrectly after a trauma event. What action aligns with regulatory compliance and adult education? A. Shred the chart. B. Ignore the error. C. Guide them through a proper correction and documentation policy. D. Tell them to fix it later. 17. What principle of adult learning supports increased retention during trauma skills training? A. Passive listening to lectures. B. Abstract theories without context. C. Immediate application of skills in realistic scenarios. D. Delayed testing without hands-on practice. 18. A trauma CNA asks questions during a hectic shift. What is the best approach for the preceptor? A. Dismiss the questions due to workload. B. Tell them to look it up later. C. Provide a brief, clear explanation and follow up after the shift. D. Redirect them to another CNA. 19. Which of the following is a regulatory requirement for trauma room infection control? A. Bleach wipe storage in open containers. B. Using gloves only during surgery. C. Proper PP usage and terminal cleaning protocols. D. Verbal confirmation of hand hygiene. 20. A CNA in the trauma room receives inconsistent instruction from two nurses. How should a preceptor address this? A. Let the CNA choose whom to follow. B. Clarify policies and standardize instruction. C. Avoid involvement in interstaff issues. D. Ignore it and focus on other topics. 21. What is the primary purpose of debriefing after a trauma code? A. Assign blame for mistakes. B. Document timesheet edits. C. Identify performance gaps and improve outcomes. D. Congratulate staff only. 22. In trauma patient transfer, which action is a CNA's legal responsibility? A. Administering 4 medications. B. Performing full patient assessment. C. Documenting vital signs and ensuring transport safety. D. Diagnosing injuries. 23. Which behavior demonstrates a lack of trauma room situational awareness by a CNA? A. Monitoring vital signs continuously. B. Leaving the room without informing the team. C. Alerting nurses to new symptoms. D. Adjusting equipment as directed. 24. A trauma CNA exhibits strong technical skills but poor communication. Which development strategy is most appropriate? A. Advanced skill modules only. B. Peer isolation to focus them. C. Communication-focused simulations and feedback. D. No intervention needed. 25. A new CNA is confused about trauma protocols. What should be the first step in curriculum revision? A. Add unrelated materials. B. Review the clarity and sequencing of existing modules. C. Increase punitive assessments. D. Remove all quizzes. 26. When mentoring a trauma CNA, which behavior indicates successful knowledge transfer? A. Asking no questions. B. Avoiding participation. C. Independently applying correct techniques in real time. D. Reliance on others for every task. 27. Which training tool best prepares CNAs for mass casualty trauma triage? A. Online quizzes only. B. Interactive simulation drills with debrief. C. Poster boards with protocols. D. Verbal review sessions. 28. A CNA transports a trauma patient without checking wristband ID. What should the mentor do? A. Report immediately to HR. B. Re-educate on patient identification protocols and supervise next transfer. C. Ignore the issue unless repeated. D. Assign unrelated modules. 29. Which evaluation method ensures a trauma CNA is competent with spine immobilization? A. Written quiz. B. Observational checklists during a live or simulated scenario. C. Self-report. D. Peer survey. 30. What is the most appropriate way to support a new CNA showing signs of trauma-related stress? A. Advise them to toughen up. B. Refer to EAP and offer supportive discussion. C. Reassign to more traumatic cases. D. Discourage talking about emotions. 31. Which of the following most closely aligns with OSHA guidelines for trauma room safety? A. Verbal reminders to wear PPE. B. Written guidelines posted at the nurse's station. C. Enforced PPE training with practical assessment. D. Assuming all staff know the rules. 32. A trauma CNA incorrectly applies a tourniquet. What instructional method ensures understanding? A. Brief verbal reprimand. B. Step-by-step visual demonstration with repeat practice. C. Send an email of the policy. D. Require textbook reading only. 33. A CNA in trauma care frequently interrupts during patient handoffs. What strategy improves this behavior? A. Ignore the interruptions. B. One-on-one coaching about closed-loop communication. C. Assign them to nonverbal tasks only. D. Include them in more chaotic shifts. 34. When designing trauma orientation for CNAs, what is the most effective structure? A. Self-paced text modules. B. Short videos with no assessment. C. Sequential, competency-based curriculum with performance validation. D. Casual peer discussions only. 35. What is the key teaching objective in trauma care for CNAs? A. Billing system knowledge. B. Early recognition of decompensation. C. Prescription writing. D. Advanced radiology interpretation. 36. What is the CNA's role in assisting during advanced airway management? A. Diagnosing obstruction. B. Administering sedation. C. Preparing supplies and positioning the patient. D. Deciding intubation timing. 37. A CNA becomes distracted during a high-volume trauma shift. What mentoring intervention is best? A. Redirect focus using real-time coaching. B. Remove them from shift permanently. C. Use public shaming to increase urgency. D. Ignore the behavior. 38. Which approach ensures a trauma CNA maintains up-to-date procedural knowledge? A. Rely on old training documents. B. Avoid refresher sessions. C. Attend periodic in-service updates with hands-on evaluations. D. Only review protocols annually. 39. In a trauma resuscitation scenario, what is a critical CNA responsibility? A. Calling time of death. B. Interpreting CT scans. C. Obtaining vital signs and reporting changes promptly. D. Prescribing pain management. 40. How should a CNA respond if unsure about a trauma protocol during an emergency? A. Wait until after the event. B. Ask the lead nurse or preceptor immediately. C. Guess based on similar cases. D. Avoid taking any action. 41. A trauma CNA leaves the suction canister full. What is the most appropriate follow-up action? A. Report to security. B. Reassign them to a cleaner area. C. Use it as a teaching moment and review policy. D. Assume someone else will fix it. 42. What characteristic is most valuable in trauma mentoring for new CNAs? A. Criticism of every mistake. B. Flexibility and empathy under pressure. C. Sole focus on theory. D. Minimal interaction. 43. In a trauma scenario, how should a CNA be guided to anticipate next steps? A. Be told only what to do in real time. B. Observe silently. C. Receive scenario-based training and feedback on anticipation. D. Focus only on cleaning tasks. 44. What documentation practice is required for compliance after trauma care? A. Delayed charting during lunch break. B. General notes at shift end. C. Timely, accurate entry into EMR per facility policy. D. Leaving it for the next shift. 45. Which behavior reflects appropriate professional communication in trauma care? A. Sarcastic comments under stress. B. Eye-rolling at team decisions. C. Calm, clear updates to the team under pressure. D. Talking over others to be heard. 46. What is the preceptor's best response to a CNA making a repeated error during trauma prep? A. Report them to HR immediately. B. Use punitive measures only. C. Reinforce learning with practice and constructive feedback. D. Ignore unless harm occurs. 47. A trauma CNA appears overconfident and bypasses protocols. What is the best corrective method? A. Ignore until an incident occurs. B. Review protocol and revalidate competency immediately. C. Promote their autonomy. D. Delegate more tasks without oversight. 48. How can CNA trauma orientation be tailored to diverse learning styles? A. Require only auditory materials. B. Include visual, auditory, and kinesthetic methods. C. Use text-based formats only. D. Avoid simulations. 49. In mentoring trauma CNAs, what fosters long-term retention and confidence? A. Passive observation. B. Regular hands-on drills and feedback. C. Isolated assignments. D. Annual reviews only. 50. What is the most critical soft skill for CNAs in trauma settings? A. Typing speed. B. Emotional intelligence and calm under pressure. CNA hospital onboarding test for trauma acute care. The Emergency Room CNA certification or hospital onboarding test is a specialized assessment designed for certified nursing assistants working in trauma and acute care settings. This test evaluates a CNA's readiness to support emergency department operations by assessing knowledge of emergency procedures, vital signs monitoring, infection control, triage support, and patient safety protocols. It may also cover topics such as responding to code situations, assisting with wound care, and working alongside interdisciplinary teams under high-stress conditions. The onboarding process typically includes both a written exam and practical skills evaluation. Successfully passing this test ensures that CNAs are prepared to deliver competent, compassionate care in fast-paced environments. Here are the top 5 beneficial uses of passing the CNA onboarding test for trauma and acute care. 1. Role readiness. The test ensures CNAs are equipped with essential knowledge and skills to function effectively in high-pressure environments. 2. Patient safety. It verifies that CNAs understand protocols for infection control, trauma response, and vital signs monitoring in emergency situations. 3. Specialized competency. Passing the test confirms a CNA's ability to support nurses and physicians in trauma and acute care scenarios. 4. Faster integration. Certified onboarding allows new CNAs to contribute quickly and confidently within teams. 5. Career growth. Specialized training positions CNAs for advancement into critical care, paramedic training, or RN pathways.